Hi, everyone. It's my pleasure today to welcome Dr. Alan Wu, Professor of Laboratory Medicine and co-director of the Core Laboratory at San Francisco General Hospital. Dr. Wu is also a prolific writer, and we're featuring here his latest book on toxicology and lab medicine stories, a sequel, which I'll drop a link in the description below if you want to access the book and take a look at it. And Dr. Wu, thank you for joining us today.
Well, thank you, Joe, for having me.
So it's a pleasure to have a conversation about TBIs, which are traumatic brain injury markers. First of all, I have to say and ask, what are TBIs and why should clinical laboratories care about them?
Well, traumatic brain injury occurs quite frequently in the emergency department. Traffic accidents, sports accidents, sometimes even abuse leads to TBI. And like with any other disease, there's a wide spectrum of TBIs. The ones that are very severe don't really require biomarkers. Clinically, you can tell if someone's having an injury and medical steps need to be taken. It's the mild traumatic brain injury, sometimes called concussions, that you don't know if it is related to injury or that perhaps the behavior is due to some other underlying pathology.
Awesome. So is this something that we expect to be performing in our laboratory soon, or would this something that would mainly be available at the point of care need? Like, how would this be implemented and utilized?
So this is an emerging field for us in terms of biomarkers, both from the central laboratory and point of care. If we're going to do testing within the emergency department, then turnaround time will always be paramount. And so I would envision that ultimately it will be a point of care device. But because we're talking about injury that originates from the central nervous system, and granted, there's going to be different degrees of breakdown of the blood-brain barrier, but we're going to need high analytical sensitivity that might be beyond the current point-of-care testing devices. And that's number one. And then number two, I think that we're going to need a multi-marker approach. We're not going to find an ideal single marker, a troponin, so to speak, for TBI.
Excellent. So, and some of those assays I've seen have already been FDA approved. They're available on automated analyzers. How likely are they to be implemented in practice? Is this something that's happening today as we speak, or is this something that needs additional research? And if so, what type of research is still needed?
Well, just like with any type of new disease and new biomarker for that disease, there's going to be a major educational program that's necessary to tell physicians what the test means, how it's going to be used, and what is the requirements for testing. And quite frankly, even though we do have FDA-approved products, they haven't been widely distributed yet. We haven't seen a big utilization uptick. I do suspect that that will take a little bit more time. We do need some additional markers, additional evidence and validations, but TBI is here to stay, and the sooner that we can embrace it, the better that we can deal with our own patients.
And so what are some of the barriers that you see to implementation here? Is it simply like from a validation perspective, I don't know the frequency of TBI, is it something that would be required as, let's say, frequently as we evaluate MIs, for example, with troponin, or is it something that's not as frequently needed, and perhaps is that a barrier for why this hasn't been implemented as quickly as something like, for example, troponin?
Well, clearly there will be centers that have a higher incidence of TBIs than others. You might think of level 1 trauma centers where you're dealing with traffic accidents. You might think of sports medicine clinics, perhaps pediatrics if we're talking child abuse, for example, which is still a cause of TBI. If you're dealing with outpatients, you're dealing with ambulatory patients, we may not see the need for TBI biomarkers, at least not from the get-go.
I see. And do you have any particular recommendations or advice for laboratories looking to implement this in their lab today?
Well, again, it depends on whether or not you have the key opinion leaders, or I should say stakeholders, that are interested in the field. And so here we're talking about neurologists, neurosurgeons, and of course, laboratory medicine and emergency department. So if you don't have these people in your camp, I think it would be more difficult to implement, and you would be best served to follow rather than to lead. But there is an opportunity for laboratory medicine personnel like you and me to lead this field if you are in an institution that sees a lot of TBI. At the Zuckerberg San Francisco General Hospital, where we are a level 1 trauma center, we see TBIs every hour in the emergency department 7 days a week. So it is a high volume, but a lot of times it is rule out, and we don't really need to do anything once we have identified these people as not having a TBI event.
And in the absence of having these tests, what is their current approach to dealing with this, which kind of speaks to the necessity for this?
Well, the gold standard today is a head CT scan. That requires the scanner to be available in the emergency department. It requires technicians to be available around the clock. There is an expense associated with that. There is oftentimes a waiting list to get a TBI head scan. That's not to speak of the potential harm that CTs can bring with unnecessary radiations for people who perhaps can be ruled out with a biomarker and don't need a laboratory test. So many reasons, and that's not counting the fact that CT scans have their own limitations. You have to wait a little bit before the injury can become evident, and sometimes you want to know as soon as possible so that you can move that patient along to the appropriate level of care.
So is there a particular group of patients or a niche where this TBIs would be effective?
Well, yes. In the professional sports world, a lot of attention has been placed towards traumatic brain injury and the long-term effects that that might have. We're talking about sports like hockey, football, soccer, skiing, where TBI is common. In that scenario, a holy grail would be a point-of-care device that can be done in the sporting arena itself to quickly rule out a TBI so that that particular participant can return to that sport at some period of time, rather than to remove them from the field of play as a precautionary measure.
Excellent. Dr. El-Khoury, thank you for sharing your expertise with us. Thank you all for watching.